here to share her pivot story is a former clinician, coach, and resume editor. She left her career in occupational therapy, gained insights into the health tech space and recruitment, and now helps purpose-driven professionals navigate bold career pivots. Katie, thank you so much for making the time to be on Life Beyond Clinical Practice podcast today, and we're delighted to share your story.
Yeah, excited to be here. Thank you.
Wonderful. Well, let's kick off with, why did you first pivot out of clinical practice? Give us a little bit of background into sort of your professional trajectory, where you started, what it was like, and what informed your career pivot.
Yeah, great question. So I started as an occupational therapist in an acute care hospital setting. And I would say fairly quickly into my career, I realized that I had made a mistake and that OT was not going to be what I wanted to do long term. So many reasons went into that. I would say the biggest ones were really just I felt I foresaw that there was a lack of growth within the field,
Right.
a lack of upward mobility. I kind of felt like every day was Groundhog Day. I always say there were, clinicians in my therapy department that had been working there for 20, 30 years, and they were, still just an OT, an acute care OT,
Mm-hmm.
and doing the same thing day in and day out. And I saw what they were doing and I thought, oh my gosh, how have they been doing this for 20 years or 30 years,
Right.
right? I just
Mm-hmm.
craved a new challenge. Like I wanted my brain to be stimulated in a different way,
Right.
right? And I just didn't see opportunities to really do that in the therapy world outside of going into management or like academia, right? Those are kind of the two options that are
For
presented to you
sure.
if you want to move up in the
Mm-hmm.
clinical world. So yeah, I felt stuck. And honestly, the other reason was just a lack of flexibility. So I was very much, hourly employee, clock in, clock out at the same time every day. I worked weekends, I worked holidays, um, and had to take PTO to go to the dentist, right? Like all of those things. And I'd just gotten married. My husband and I wanted to have kids in the future. And I thought, I don't know how people do this and be a parent, right? Like there's just like no options for
Yeah.
flexibility unless you really want to go into like the home health therapy world, which I knew I did not want to do. And so yeah, I just I needed more growth. I needed a challenge, right? And so I just knew that I needed to make a change.
Love that. So much of what you said, Katie, I've heard repeatedly from clinicians, who are still
Mm-hmm.
stuck in the thick of things. And, personally, I can relate. When I decided to pivot out of clinical practice, part of the reason was because I thought, okay, for the rest of my life, as a clinical optometrist, I'm going to have to work weekends. Most practices are open Saturdays now, even Sundays, and
Mm-hmm.
peak holiday seasons like December in South Africa. December sort of just summer, the peak time where people are out and about. So optometrists were very busy December, January. So there was no opportunity to take leave during those times. And I'm like, I don't want that for myself. So I
Mm-hmm.
loved what you said. You were very clear as well about what you didn't want.
Mm-hmm.
And that's the first thing for me that I say to people: get clear on what's not working, what you don't want, and then let's work on, what you do want and what do you want the next phase of your career to look like. But for you, what were some of the biggest lessons you learned when you decided to transition into a non-clinical career? And tell us a little bit about that path outside of OT. What were some of your next steps?
I decided that I wanted to go non-clinical, and I would say from the time that I made that decision to when I actually landed my non-clinical role was pretty short. So this was back in 2020. So I think there was just a lot fewer people going non-clinical, and some of the
Mhm.
competition for the non-clinical roles out there was a lot less fierce than it is today. And job market's different,
Right.
and certainly between now and then. But yeah, it only took me about 4 or 5 months to land my non-clinical role. So really not too long. I'm very thankful for that. But as far as the journey itself, I like to tell my clients that I work with, like, I made mistakes so you don't have to, right? Learn from my
Right.
mistakes because I was pretty desperate to move into something else. And so I was very much operating from the mindset of like what else could I do? I need to get out into something
You
else,
just need to
right?
get out. Yes.
Yes, I just needed to get out, and I was not operating from a mindset of like, what do I want to do, right? Like I did
Mhm.
no really like deep dive intentional thinking about myself and my strengths and like what would align with that. I was just very much like, I need to get away from therapy. What's possible for me with this
Right.
degree and the experience that I have so far? And so I ended up as an implementation consultant at a health tech company that did clinical communication software, like secure messaging in hospitals. And I was an implementation consultant, so basically was just working with hospitals and healthcare systems to like implement the tech product into their own
Right.
company, right, in their own system. And while in some ways I feel like it was a good fit for me, in other ways it very much was not, and I kind of had to learn that on the job. So, I learned like, wow, I think I prefer more like an internal operations type role as opposed to customer facing, right? Or
Right.
like patient facing, right? I that kind of translated back to even OT. If I'd really taken the time to dig in, I would have
Mhm.
thought, oh, maybe I don't love like the patient interaction side as much. I really love like fixing the problems behind the scenes,
The
right?
back
Making
end.
things run
Yeah.
more efficiently. That's like my sweet spot, not necessarily like the face to face interaction all the time.
With
I'm
patients.
very
Yeah.
much an introvert. And so talking to people all day, as an OT was exhausting. In an
I
implementation
can
consultant role,
imagine.
yeah, you were working with clients a lot of your day. Even though you're remote at home, you were sometimes on back to back calls talking to people for hours, right? And so I wish I'd just taken a little more time to think about those things and try to
Mhm.
figure out, okay, what are my strengths? What are the problems I love to solve? What do I care about, right? And like, how does that translate to a role, and just go about it a lot more intentionally rather
Right.
than like I said, I always tell clients like, don't operate from a mindset of like, I'm trying to run away from something
Oh,
bad, so I'll just
totally.
take anything, right?
Mhm.
Try to be intentional and like actively running towards something that you're really excited about.
Oh, love it. I echo that message on the podcast as well, because well, more often than not, you're going to encounter this. Okay, initial sense of relief that you're out of something you didn't want to be in anymore, but very quickly realize that where you are is not where you want to be. So
Yep.
being so clear about moving towards a more positive direction than rather just escaping from sort of a role or a situation that you're unhappy with in the workplace, I think that is
Mm-hmm.
so key.
Yep.
And then I love that even though you realize that that wasn't exactly the ideal type of role for you, that you drew something from it. You learned more about yourself and sort of what's going to be better for the next phase of your career. So how did you
Yeah.
then move from sort of health tech customer facing roles to what you did next in your career?
Yeah, so I was an implementation consultant at that first health tech company for about a year. And I wasn't really seeking out a new role actively, anything like that, but um, a recruiter from the company that I ended up at next, a recruiter from that company just reached out to me on LinkedIn because I had an implementation consultant job title basically and
Right.
said, "Hey, we are hiring implementation consultants at this company. Are you interested in applying? Would you like to interview?" And I'm never one to turn down an interview or an opportunity, right? I like
For
to
sure.
explore, so keep my options open.
Yes.
So I said, sure. And yeah, I was in talent acquisition software. So that kind of brings me to like you mentioned earlier, like I dabbled in the recruiting world, right? So I spent three and a
Hmm.
half years at a company that is a major vendor in the applicant tracking software space, right? So my company made ATS, an ATS software platform that we then sold to other companies, right?
Okay.
And so I got hired there as an implementation consultant. I was a very steep learning curve as far as like the talent
I can
acquisition world
imagine.
because yeah, nothing related to healthcare whatsoever. I think on day 3, I asked, like, what's the difference between a recruiter and a hiring manager? I had no idea what I'd gotten myself into. But I rolled up my sleeves and made it work and did well.
Wonderful.
And so I did implementation consulting there for about the first year. And then I'd been pretty vocal early on of like, I would love to do something different and just have the ability to kind of stretch my wings and get into more of that internal operations side of the house as opposed to being customer facing. And
Hmm.
so that's exactly what I did. So I ended up working in what was called the Center of Excellence at that company in a variety of roles. So I was like a resource manager. I did special projects and initiatives. I did process improvement projects, all kinds of different things, which was ultimately a lot better of a
Wonderful.
fit for me
Mm,
than being a customer facing implementation consultant.
right.
And was just a great experience overall learning about the talent acquisition world. So yeah, very unorthodox career journey, but I'm thankful for it. It's been a great experience so far.
That's fantastic. And I love that you said it's a journey because that's what I always emphasize, that it is a journey of discovery, a journey of learning what's more aligned with who you are, who you are becoming and what you want for the next phase of not just your professional life, but also your personal life. And I know
Hmm.
post, that job, working in the recruitment world, you've now created the Career Cultivator. You want to talk a little bit more about that and what led to that move?
Yeah, so I started the Career Cultivator, which is just career coaching, resume editing. I kind of brand myself as like helping any professional who's making a very big career shift. So think, a clinician who's trying to break into the non-clinical world, a teacher who's trying to move out of the classroom, right? But
Right.
primarily, I still work with healthcare professionals as my main wheelhouse and kind of area of specialty. But it was something that I had always kind of thought about in the back of my mind. I have always loved resume editing for family and friends. I've always been
Mm.
kind of nerdy in the fact that I love like career pages, right? Love looking at job descriptions. I've always loved like sending jobs that I find to people that in my life that I think like, oh, you'd be really good at this,
Might be a
right? And
good
they're
fit.
like,
Yeah.
and they're like, I'm not looking for a job, Katie. And I'm like, but apply to it. So if something I'd always thought about and people told me like, you should
Hmm.
do this for real one day. And for some
That's
reason,
awesome.
it was March 2024, and I was literally like 2 weeks away from giving birth to my second son. That was the time I was like, you know what? I've been thinking about this long enough. I'm going to do it, right? And so
Fantastic.
I launched my business and started out slow, and I had 5 months of maternity leave, which was fantastic. Tech world is great for that kind of thing. So
Awesome.
I kind of started out slow and just started building and building. And I was lucky enough to work at a company that was very supportive of me having my own kind of business to do in the evenings
Lovely.
outside of
Yeah.
regular work. So I did both of them for about a year, which was fun, but kind of exhausting. So
Hmm.
yeah, in May of 2025, I decided, you know what? I'm going to take the full on leap into the Career Cultivator and go all in. And it's been great and haven't looked back. It's been great.
That's awesome. Well, congratulations on that bold career move. So,
Yeah.
what would you say, especially since as a former health a clinical professional yourself, coming from that world and now working with lots of clinical professionals who want to navigate these bold career moves, what are some of the biggest hurdles, mindsets, or otherwise you find that hold them back?
Yeah. So I would say mindset is actually probably the number one thing that I see that holds people back. It's really, really, really hard when you're going on a non-clinical
Yeah.
pivot journey because pretty much every clinician that I talk to mentions imposter syndrome and struggling with that.
Yeah.
It's very common. My personal theory is that stems from we go to a very specific school to get a very
Hmm.
specific set of knowledge, very specific license, and we apply to very specific concrete jobs, right? What you see is
Totally.
what you get, right? And
Hmm.
when you are contemplating going non-clinical, it's this unknown world, right? Where
Yep.
anything outside of that clinical box, you automatically think, how could I be qualified for that? I don't have the skills or
Totally.
training to do that, right? And so it's such a struggle. And I always tell clients who mention imposter syndrome, I am not a mental health therapist. I'm not a life coach. I'm not any of those things. Very much want to
Hmm.
like stay in my lane and,
Right.
serve in the role that I can. But I do think working with a career coach can help with work like solving imposter syndrome in that two specific ways. So the first way is that it's really hard to see yourself clearly. Any of us, that goes for any of us as a human being, right? It's hard for us to like look in the mirror and not be super hard on ourselves or doubt ourselves, right? And I think there's a lot of
Mm-hmm.
value sometimes from working with someone who sees yourself in a much more unbiased, kind of third party observer to your life way to very clearly say, like, you can do
Totally.
these things. I see this in you that you don't see in yourself, right? So
Yeah.
I do that all the time with clients. I send them a job and I'm like, you could totally do this. You'd be amazing at this. And they're like, I couldn't do that. I don't have, I'm worried about I'm not qualified. I'm like, oh my gosh, yes, you absolutely are. So I think the more you kind of hear that over time, the more you start to believe it. So
Right.
that, and then the other piece that I feel like can really help with imposter syndrome is honestly going through a collaborative resume editing process. So I'm a big, big believer in a resume that's got numbers and metrics in every single bullet point that show your
Wow.
transferable skills and your impact. And that's like one of the biggest struggles that clinicians have when they're thinking about going non-clinical. Like, how do I do that? Right. And I think when you go through a collaborative resume editing process, where we're really digging into every single bullet point of like, what do you mean here? How are we going to measure success? I'm
Wow.
thinking maybe these three ways, or what are you thinking? Explain to me what you mean by project here, right? Give me an example.
Right.
With that back and forth as we start to shape that resume and each bullet point, I think clinicians can really take a step back and be like, oh, I have
Wow.
done amazing things. Look at all
Yes.
the impact and transferable skills I have for the job that I'm targeting, right? And it also really just helps with confidence going forward into that non-clinical search, especially with interviewing, right? Because I say every bullet point on your resume is just a snapshot of a wider story that you want to tell.
Yes.
And so you have just having to go through that collaborative process, you can explain every bullet point and feel confident in that number and metric and the impact that you had and what transferable skill that is. So I think, yeah, with mindset specifically, those are a couple of ways that
Mm-hmm.
working with someone can really help if you're really struggling with that. I just wanted to briefly mention too, like another hurdle
Sure.
that I see a lot of clinicians struggle with is getting others outside of the clinical world to see you as more than a clinician. Um, because, like I was just saying, like it's especially hard to get others to see your transferable skills when you don't believe that yourself. So
Yourself.
that's definitely the
Yeah.
first step is kind
Yes.
of seeing yourself clearly and realizing like, oh, my clinical background, even though it looks very black and white and concrete about the job duties I was doing, like it's really a lot more transferable to other jobs in the non-clinical world than I might have originally
Mm-hmm.
thought, right? And so I think the best way that you can get others to see yourself as more than a clinician is by truly owning your experience, realizing what your transferable skills are and finding a way to position yourself and translate that to whatever your target role is, right? And just ultimately realizing like your clinical background is not a liability. It's not something to hide. It's something you should be
Yes.
proud of and should be an asset in non-clinical roles, right? Like clinicians, I'm a big believer that clinicians are like the best fits for so many different types of roles just
Wow.
because of the skills clinicians have that you just have to develop on the job. So, yeah,
Totally.
those two
And I
major
think
hurdles, but yeah,
the fact that you have insight into both worlds, right? I think you're well placed to make that statement. So thank you so much for sharing those sort of just
yeah,
highlights of resume. I would say not necessarily tips, but what's important to go into your resume when you're thinking of pivoting, and the importance
hmm
of working with someone skilled in that area like yourself. Because
right,
I think the way you've outlined it, then clinicians will definitely see their value in a new light and be able to see the possibilities that exist for them outside of clinical practice. So, what
hmm
advice would you give to aspiring pivoters? And how can they strategically position themselves for a successful pivot? Whether you mentioned some of the sort of resume editing work, but just in terms of their profile, their branding, any other tips you have that can help
yeah.
someone who's listening to this and thinking, oh, well, maybe, just maybe, this can work for me and I'm ready to take the next step.
Yeah. So I think a lot of people, when they're thinking about going non clinical, want to immediately dive into some of that more concrete some of the more concrete aspects, like, okay, I got to edit my resume. I got to update my LinkedIn
Right.
profile. I got to learn how to network, right? And all of that is very important. But I always say don't overlook that very, very first step of knowing where you're going first and just being very
Oh.
intentional about that, right? Because
Mhm.
I always say, so I have an order of operations that I kind of prescribe to clients that work with me. Just a series of steps to follow on really any job search, but certainly a non-clinical pivot as well. And that very first step is getting clear on your target role, figuring out where you're going. And the reason why you have to do that first is because everything else flows from that.
Right.
So, your resume, for example, that's your marketing flyer to show people that you have the transferable skills to do whatever job you're trying to get, right? And if you don't know what job you're trying to get, you don't know what transferable skills to show that you have in your resume.
Mm-hmm.
Networking, being able to tell people very concretely, like, yes, I'm looking
Right.
for this type of role. Here's why I'd be an asset in it, and here's why, right? Like, if you are just
Wow.
kind of like, I'm looking for anything that's remote and gets me out
Mm-hmm.
of clinical care, like, that's not going to position you very well, right?
Totally.
So it all stems from figuring out where you're going. And to that end, I would say don't skimp on that part of the process. I think a lot of people, the inclination is because you want velocity and you want action.
Yeah.
It's easy to kind of overlook that first step of the process and just land on something quickly, or because you see other clinicians are landing roles in that area. So you think,
Right.
okay, I could do that, right? But you really first have to take a step back and understand your unique strengths, like what you care about, the problems you love to
Mm-hmm.
solve, right? And understand how all of that together transfers to a specific target role first before you
Yeah.
go on to any of those other concrete steps in the process. So definitely that. And then the other thing I would say is don't be afraid to put yourself out there and hear the word no. So, going on a non-clinical pivot journey is very much an uncomfortable experience, right? It's
Mm-hmm.
something we are used to being in our clinical box, which is a very safe and comfortable place to be.
Yeah.
And when you are thinking about going outside of that box, it's like, oh my gosh, what if people don't like me? What if I hear no? Right. And that's just like natural human. We're wired to think that way, right? So it keeps us
Yeah.
safe. But in order to make progress, you have to put yourself out there. You have to be okay with,
Totally.
okay, I'm going to send this intentional networking message and maybe the person will ghost me or I'll never hear back from them. And that's
Yep.
okay, right?
Mm-hmm.
Or I'll apply to this job and I might hear no. I probably will hear no, right? I'll hear a
Yeah.
lot of no's. And you just kind of have to be okay with putting yourself out there. And
I
I always
love
say,
that.
like, what's the worst thing that can happen, right? You hear no or you get ghosted. That's okay.
Move on.
It's not the end
Yeah.
of the world. You can move on. There's always, the next step, right?
Totally.
So definitely those two things of understanding your strengths and then not being afraid to hear no and just put
I
yourself
love
out
it.
there. Yeah.
Totally, I love that because, yeah, that's so important. You have clarity, which is why sort of clarity and confidence are my two main things. When I talk about the podcast, you have to be clear on what you want and what you don't
Mm-hmm.
want, right? Things you're trying to move away from. When you're
Yep.
clear on that, as you say, everything else that you do follows, sort of then sort of informs what you do going forward.
Yep.
So, yeah, I love that you echoed that, and I think this has been such a valuable conversation that can help many people. I know ones I've spoken to recently who's in the thick of things that could benefit from your services working with you, Katie. So thank you for the wonderful work you've done, bringing your expertise in your pivot journey and what you've learned to help others. And yeah, here's wishing that you're impacting so many more lives through the Career Cultivator, and look forward to potential future collaborations between Life Beyond Clinical Practice and the Career Cultivator, and where that can take health professionals looking to pivot their career. So thank you so much for sharing your journey, your story, some of your insights that can help listeners to this podcast take their next step.
Yeah, absolutely. Thank you so much for having me. It's been a great time.
Yeah, you're welcome, and always lovely to have these conversations.